I can tell you as a psychiatrist that I've never been able to stop myself from taking that person in front of me who's struggling with their own personal issues, but also the external forces that drive whether they get care, whether it's fair, how they get it. I'm constantly drawn to those larger issues at the same moment that I'm drawn to helping this person individually. It's impossible for me as a person to not want to keep fixing the problems of the system and to fix what's not fair. And there are a lot of things that aren't fair, not necessarily because they were meant that way, but because of history and the way things have come about. But there are a lot of things that affect people that I see every day that I think I have experience with them and through them and want to have a voice in making things better. I see a couple different ways to think about the role of the community psychiatrist. So first, clinically, I think it's really important that we figure out a way to change reimbursement or the payment structure overall so that the psychiatrist can be more than just a nominal member of the treatment team. As we move towards these efforts of integrating mental health, behavioral health with the rest of the healthcare world, psychiatrists who are physicians, who have a background in medicine, who grew up in that system and are comfortable with it, are natural liaisons for that. We're a natural connection to healthcare, and I think it would be short-sighted not to use us and leverage our ability to speak the language, so to speak, of the rest of healthcare as we work towards integration. The National Council, under the leadership of Linda Rosenberg and with the collaboration of SAMHSA, was really among the first to recognize that the voice of psychiatry had gone missing in behavioral health care. And they developed this program and in order to address that and to bring in psychiatrists, not just to train them, but also to allow them to contribute. So under the leadership of Dr. Anita Everett, who's lead faculty, the National Council staff, Chuck Angolia and Mohini Venkatesh, have put together this really amazing year of experiences for us. There are educational aspects to it, such as we have a mentored clinical improvement project that we're taking part in. So we each come up with a project, but we have professional mentorship for the whole year along the way, and we will present our projects at the end of the year at the next National Council meeting in San Diego. In addition to the education part of it, though, has been the opportunity to contribute and to have a voice and to learn how to have a voice. You know, for example, being here at Hill Day, this is something that I'm certain I never would have experienced or had the opportunity to experience without this Psychiatric Leadership Program, and I'm extremely grateful for